In May 2010, Greek Prime Minister George Papandreou announced an additional package of austerity measures. They included cuts on public sector wages, pensions, new taxes on businesses, an increase on luxury taxes, and a rise on the value-added tax. The cuts on governmental expenditures were in line with the European Union and the IMF as a means to rescuing the Greek indebted state from a default. The objective of the attempted reform was to improve the economic situation of Greece as soon as possible. It was the most difficult governmental attempt that has ever been made in the modern history of Europe. Papandreou submitted the bill including the severe austerity measures to the Greek parliament on the 4th of May 2010. The following day there was a general strike in Greece. A number of 100,000 protesters marched through the Greek capital Athens. It was one of the most active and biggest strikes that have ever taken place in the country since 1974. After the 5th of May 2010, life in Athens has rapidly changed for the worse. The unemployment rates have skyrocketed to more than 28%. Unofficial sources report the true percentage of the unemployment is 32 to 35%. 6 out of 10 individuals between 15 to 24 are jobless. The same applies to 40% of those between 25 to 34 years old. Men and women in their mid-40s who had been laid off are not likely to find new occupation soon. Retirement is not an option as they do not meet the requirements of becoming pensioners. The occupations that have been mostly affected are unskilled workers, vendors, machine operators, and office workers. According to a report by the Bank of Greece, the average gross earnings have been cut down by more than 25% between 2010 and 2013. The number of individuals who live in poverty and material deprivation have reached 3.8 million. For the first time in the contemporary history of Greece, the people who neither worked nor looked for work were 500,000 more than the economically active ones in October 2012, the Hellenic Statistical Authority highlights. In Athens, the impact of the high unemployment rates is more than evident. The Greek capital is in a state of social crisis. Massive unemployment and deep budget cuts have resulted in a huge increase of the uninsured individuals. They have soared to at least 2.3 million. Hundreds of thousands of residents of Athens do not have the means to pay for the state-subsidized health services. At the same time, eligibility for free healthcare or medical treatment has been tightened. Does an individual with no financial resources have access to the health services of the state?
No, this is very difficult. This is one of the major problems of the crisis, one of the major aspects of the social crisis that Greece experiences at this moment. And the problem is that people that have lost their jobs and a significant part of them are uninsured. Now we have, as I said, a very large. The number of total unemployed in Greece, more generally, is more than 1.3 million. Right now, more than 50% of these people now are long-term unemployed, which means they are unemployed for more than 1 year. And once a large part of them also is unemployed for more than 2 years. These people unemployed for more than 2 years have no insurance coverage, healthcare insurance coverage. This means that they do not have any access to the public health structures, with the exception of emergency cases. If there's an emergency, then a hospital can treat you, but otherwise you do not have access to the public free of charge health structures.
Athens has always had a problem with homelessness like any other big city. Because of the financial crisis, poverty has slowly grown out of control. The number of homeless individuals in Athens has increased by 30% since 2009. These are referred to as neopours. They are homeless individuals who look for shelter around the historic center of Athens. So, is the increase of the homeless people in Athens a result of the high rates of the unemployment?
I think yes, although again no exact statistical data exists, no proper survey has been conducted on this. I think it is quite obvious that, as I said, the new homeless people are primarily unemployed and uninsured people that have lost their income, or the income is so now so much reduced, for example, 200 or 300 euros per month, that cannot afford to an apartment or whatever other kind of accommodation. So yes, I would say a substantial part of the increase in the number of homeless people has to do with unemployment.
A few blocks away from the historic center of Athens lies the chic and aristocratic area of Kolonaki. Traditionally, it is the home of the in-town rich. Kolonaki is also one of the Athenian leading shopping areas. From the Xameni Square up to the streets below the Elisabettos Hill, one may walk along a mixture of old neoclassical houses and modern flats. A 46 square meter apartment in the area of Kolonaki costs 210 euros per month. The rent for an apartment twice as big may reach to 450 to 500 euros. A newly constructed and luxury apartment of 340 square meters is rented for 8,000 euros per month. But who can afford such rents at times of severe financial and social crisis? An Athenian elite, a minority of wealthy individuals. During the financial crisis, the gross income gap between the rich and poor Athenians has grown even bigger. As a result, social inequality has become worse. Poverty-stricken Athenians and the prosperous residents of Kolonaki live one next to the other, but their daily lives may be described as two entirely different realities. The enormous needs the financial crisis has created in Athens must be addressed. Due to the limited available funds, the state is unable to provide adequate support to the vulnerable social groups. Citizens on their own initiative try to support one another. Which forms of social activism are taking place in Athens nowadays?
Mainly in the field of health and social welfare. There are organizations that offer important work in primary health and mental health. They take care of the homeless, the elderly who have no social protection and inadequate security. A number of organizations operating in Athens offer a viable solution, but to a limited extent in relation to the existing problems.
How do self-organized social care groups finance their activities?
Firstly, most organizations are financed by the citizens themselves. Second, by few private corporations. They are also partially financed by the European Social Fund. Society and the citizens do not support social activism with the same amount of funds as in the past.
Is Athens really divided between a privileged elite and a majority of people living in poverty?
In times of such social crisis, the first main characteristic is the accentuated social inequality. This is what we see today in the Greek and Athenian society. There is an elite of people gathered around political and economic power who have not lost part of their income. On the other hand, the welfare state is not able to soften the contrast between this elite and the unemployed and socially vulnerable groups. We have not experienced such a phenomenon since the Civil War. The point at which we are right now is one of great contrast. This means there is a high risk social outbreaks. As long as unemployment swells, there is no other prospect.
There is no doubt that social inequality is an ongoing threat for the well-being of Athenians. Social activists and volunteers with limited funds from the state support those in need. The sustainability of social activism is uncertain. A question to be answered is whether or not the Athenian society will survive this crisis.